up in the first place. So I'm very excited about this idea of the healthcare insurance exchange, and glad that Mr. Kagen, you've been leading on it.
Well, thank you for yielding. The consumers of America need to be able to compare apples to apples. And really, the only way to get that done is to come up with at least a basic federal standard insurance policy. One that'll cover the basics and keep you in your house if you get sick. One that every insurance company has to offer to every willing purchaser, every citizen and legal resident within a metropolitan area, where we can create the largest risk pool possible to leverage down prices for everyone. And here I have someone in rural America. This is really a telling story. She's from Waupaca, Wisconsin. And, quote, no health insurance for 4 years. One son in the Army on active duty. My son's shipping out. He's guarding our home, but we're not taking care of our families here at home. We're taking care of people overseas. Quote, we know numerous people over 50 who've lost their jobs so companies can cut health care and payroll costs, and then can't find any other work and no longer have health insurance. Now, this is, close quote, this is being multiplied all across the country as this recession rolls across not just the United States, but across other nations as well. We have to establish a basic insurance policy so we can begin to have an open and transparent and very competitive marketplace for insurance products.
Gentlemen, yield for just a second.
Yes.
I mean, let's think about that soldier that comes back from serving this country overseas and goes and gets a job that pays a decent wage but works for a struggling company that just can't afford to continue to employ people and give them health care benefits. And so he, returning from serving this country abroad, putting his life on the line, comes back and gets a decent, hard-working, fair-paying job and has no health care benefits. And then he looks to this House. He looks to the people that he sent to Congress, who sit here in this nice air-conditioned chamber with pretty decent health care. And he wonders to himself, I fought for this country. I came back and got a job, did everything I was supposed to. And the people that I send to Washington, D.C. get a pretty good health care plan. What am I left with? I think that whatever we do, whatever federal regulatory scheme that we come up with for health care insurance, it should at least guarantee that everybody out there gets to have health care like we do. That if you're going to elect men and women to go to Congress who are going to enjoy the benefits of the federal employee health care plan, that every American out there should have the access to that. Certainly those that came back duty overseas and are playing by all the rules we asked them to when they return, Mr. Kagen.
Well, be careful there, because you may just get what you want. I mean, there's nothing to say, really, that the health care that you have is the best available. I'll bet you don't understand completely what you've got for insurance, because it's so hard to read and interpret that policy. We've got an idea here that's kind of a good idea, but like many things here in Congress, if it makes sense, it just may not happen. So what we really have to do is just clear away all the clutter and ask some very basic questions. Do you want to have an opportunity to go to the pharmacy and pay the lowest price available for that prescription? I think you do. Is there any reason why someone should be discriminated against? Now, let's say there's 5 of us stand in line to get the same prescription, 30 pills of drug X at a pharmacy. Why should we pay 5 different prices? Why shouldn't they just put the sign up on the wall and say, here's what it is? Put it on the internet, here's what it is. And let's get some competitive forces to leverage down these prices. You know, when insurance companies have to compete in an open marketplace, we're going to leverage down that price. My best guess is about 22% before they really begin to compete for the customer, just like the auto dealers competed for my precious dollars for that Chevrolet Impala. So I look forward to a competitive marketplace. As you know, I chose not to select health insurance when I got here. It was offered to me, and I was quite surprised. They said, well, Congressman, before you leave to go back to Wisconsin, would you like to hear about the benefits? And I said, lady, are you kidding me? What are you talking about? And she showed me a list of health care benefits, a cafeteria of plans I could choose from. I had to go catch a plane. I said, well, okay, what did you take? Oh, I took the Cadillac plan, she said. $250 deductible, they got to take you because you're a government employee. I said, well, I'll tell you what. As soon as you can make that same offer to everybody else that I have the honor of representing, I'll be happy to make my choice. I agree with you that we have to have choices, but they've got to be openly disclosed, and we need to get a basic insurance policy that really says if you're a citizen, you're in. Now, one of the things I really am pleased about this president, President Barack Obama gets it. He doesn't just get it in his mind. He gets it in his heart. He actually feels what we feel, what my patients feel. And he has taken the single most essential element in health care as his number one element, and that is no discrimination due to pre-existing conditions. When we frame health care around our civil rights, we're not saying you have a constitutional right to this or that service. We are saying that you shall not suffer from discrimination based on your genetic potential, like we passed last year. You will not suffer from discrimination at the pharmacy because you have less money in your pocket than somebody who's getting a discount and not you. And you mentioned about our veterans who served not for themselves but for their country. Isn't it appropriate that when a veteran comes home that his wife and his family get the same discount on that medication they might need? And what about their neighbor? What about their whole community? And what about their entire country? Isn't it appropriate that if the pharmaceutical company is making a profit at the VA price, that we all benefit from his service or her service and that leveraged down discount price? We have to begin to use the leverage of the marketplace. Now, I'll finish up with my comments by saying that we have witnessed in the last year the collapse of a housing bubble, and that repercussion, that ripple effect in the economy has just taken down many millions of jobs, taken away businesses left and right, and continues to do so. I believe we're also looking at another bubble, and that bubble is in the price of health care. It's simply out of reach for ordinary families, averaging $1,200 to $1,400 a month for insurance premiums, and it guarantees only one thing, that every month the insurance company is going to take your money and you have to fight like hell to get it back. Having insurance today doesn't guarantee that you're going to get the services that you need. That's how Chairman Over was able to show us all the data. We are spending a lot of money for health care. We're not getting the value. So I think it's time to begin to ask the question if we shouldn't begin to change the process of how we're going to reward the delivery of health care. Change the process and reward value, not just per head or per prescription. We have to begin to reward value and prevention. Look, you are exactly what you eat. As my father says, Steve boy, pollution begins at your lips. If you don't put it in, it won't stay on you. Well, okay, I'm doing my best to lose weight, Dad, but the reality is we can do this by working together. It will take Democrats, Republicans, Libertarians, and Independents. The American people don't want any more argument about this. They want us to come up with a solution that works for their budget, that works in their home, and works within a framework that guarantees that if you're a citizen, you're in. If it's in your body, it should be covered. I am more confident tonight than ever before that this year we're going to achieve that goal of guaranteeing access to affordable health care for everyone that's legally here.
Thank you, Mr.